Greetings, world, and welcome back to another episode of the NeuroWellness Project, a podcast devoted to exploring compassionate and evidence informed approaches to autism. Last week, we saw the U.S. government make its first formal attempt to address the autism situation. And for many of us, this was a bittersweet moment because if it wasn't already painfully obvious that we are living in a split reality, this press conference has thrust some incredibly complex and difficult topics into the spotlight, including the search for what actually causes autism and whether or not we should be treating it at all. A recurring theme of this show is that autism is a blanket diagnosis with a whole host of complex underlying factors and presentations. And this very notion challenges us to rethink how we approach research, diagnostics, and treatments of medical conditions and the people who have them. It's just not as simple as everybody wants it to be, to fit into this mechanistic trope of cause equals X, cure equals Y. This gene causes this. This product cures that. Tylenol is the cause. Leucovorin is the cure. This mindset just does not work when we are approaching autism. And what we are witnessing in real time is autism splintering the medical and scientific community and society at large. On one side, you have the reductionist model that is clinging to rigid assumptions and that one size fits all approach that has dominated healthcare for over a century. And on the other hand, you have a new paradigm that is calling for holistic, personalized protocols, treatments that are tailored to the individual and not the diagnosis itself. What we are up against here isn't facts or objectivity, it is dogma. And that is precisely what makes this battle so brutally challenging. But thankfully, in the midst of this struggle, there are courageous and visionary scientists and doctors who are willing to step into the unknown and push the frontier of what's possible. And one of them is joining us today. Dr. Richard E. Frye is a pediatric neurologist and a national leader in autism research, specializing in neurodevelopmental and neurometabolic disorders. He holds graduate level degrees in physiology, biophysics, biomedical science, and biostatistics, and is board certified in both pediatrics and neurology. As both a medical doctor and a scientific researcher, Dr. Frye has authored over 300 publications and has led numerous clinical studies exploring underlying physiological abnormalities in children with autism, as well as demonstrating the efficacy of safe and novel treatments, including a recent double-blind placebo-controlled trial on folinic acid, aka leucovorin. Dr. Frye is also the author of the book, The Folate Fix, exploring the role of folate in autism and neurodevelopmental disorders. And he has been featured extensively in the news and media for his pioneering work. Dr. Frye sees patients clinically and is also the co-founder and chief scientific officer of the Autism Discovery and Treatment Foundation, a C3 that is dedicated to advancing biomarkers research and therapies for complex neurodevelopmental conditions. His current focus is working to make autism treatments more personalized, using science to guide protocols that fit each child's unique biology. And it is such an honor to welcome Dr. Frye to the NeuroWellness Project. Dr. Frye, welcome. Thank you so much for taking the time to talk with us.
Yeah, my pleasure. Thank you for the invitation.
Of course. So let's dive right in. I know that for a while you have been kind of like the go-to guy for precision medicine in treating autism. But I'm wondering if there was like a particular moment or an experience that you had that kind of led you in that direction.
Yeah, I mean, I always say that I didn't find autism, it found me. And yeah, I was very interested actually in learning disabilities and behavioral neurology when I was a fellow. I was training, and that was in about 2004. And that's when autism started to become more and more recognized.
Mm.
So parents would come to the neurology department and say, "You want to see a neurologist," and nobody knew anything about autism. But so, who do you give it to? You give it to the fellow, right? Let them figure it out. And I kind of took it as a challenge. And I had been really interested in that when I was in pediatrics. So I said, "Oh, I know how to do that." Oh, and what happened is when I started to get my jobs, I left residency. Everywhere I went to the department, my colleagues would go, "You know something about autism?" Because I got a whole clinic full of them. So they'd send them to me, and, when I was at, University of Texas, in Houston, I had to form what I call a medically based autism clinic because I was looking at these, underlying medical, issues, which I could do. So if a kid isn't, developing, we do the $1,000,000 workup on them. We do the EEG and we do all the testing and we do lumbar punctures to see, if there's something going on in their brain. Is there some inflammation? Is there, any types of abnormal neurochemistry? And that's where I started to find out, yeah, a lot of these kids had abnormal neurochemistry and they had, you know, uh, folate in their cerebral spinal fluid. And that's when I also realized, that Dr. Rainmakers and Dr. Quatros had just described this disorder called cerebral folate deficiency. And I tried to treat a couple of them and they made, these miraculous gains. And we learned that, Dr. Quatros had this folate auto antibody you could test as a blood test, maybe identify the kids, you know. So at that point, I had started to, develop almost a precision medicine approach because I knew I could do an EEG, I could look for mitochondrial disorders. And once you start adding it up, right, you're treating real kids.
Yes, yes.
And that's how it kind of got started. The cerebral folate deficiency thing really was a big find. So when we realized that that's some of these kids, we didn't know how many, but we knew we could test the folate autoantibody. And so that's when I teamed up with Dr. Rosignol. We both had autism clinics. And we said, well, why don't we just see like how many kids have this antibody in their blood? Is it like 3 or is it 100 or what? And that led to our first study, where we found that 75% of the kids, had this antibody that blocked folate from getting into the nervous system. Um, and at first, when I would ask parents, first I would do the test, and if it was positive, they'd have a lumbar puncture. And then we got kind of used to using leucovorin, which is so safe and didn't really cause side effects, very well tolerated, and
Mm.
saw some improvement that we started saying, well, do we really need to do the lumbar puncture? And the thing about a lumbar puncture, also known as a spinal tap, where you have to
Mm.
take out of the liquid that surrounds, the brain and spinal cord, is that people get it many times in the emergency room because they think they have an infection. And when we do that, it's an emergency. But when you do a lumbar puncture for neurochemistry, those were measuring things at very, very, very low levels. So it has to be perfect. And so in order to do that, need sedation, you need fluoroscopy guidance. So it's really a big thing, right? So it came to the point where I started to ask our parents, would you like a lumbar puncture to verify this before we attempt treatment, or do you want to try the treatment because it's pretty safe? And as you can imagine, a lot of them said, yeah, maybe not. Maybe I'll forgo that lumbar puncture. And we started to get more and more comfortable without doing that lumbar puncture to treat children. And so what we did is children that were positive, we treated with leucovorin per the studies that had been done. And we found, and then we asked parents when they came back approximately 4 months later, what had improved. We put a standardized scale together so they can tell us how much improved or how much got worse. And then we compare that to what we call waitlist control group of people that were waiting for results and hadn't made any other changes. And we found that, wow, miraculously, two-thirds of the kiddos really improved in language that received the leucovorin. And so that led to our first publication. And we were so surprised. We thought next year everybody was going to be describing it. And now we're 15 years later almost.
Wow. Well, better late than never, I guess.
Exactly. It's that a lot of people are catching on to it. And I think, one of the most important things about the announcement last week that, this is potentially a treatment for autism isn't so much leucovorin itself, but, it's such a significant thing for somebody in power to say autism is treatable.
Yes,
There's so much,
absolutely.
there's so much misunderstanding that autism is genetic and it's not treatable. And both of those are absolutely untrue. And we've gone 20 years just looking at genes and not developing any treatments. And we got to stop that. Genetics is important, but we have to move on and we have to,
Mhm.
really turn to a new era where we really concentrate on treating kids and making them better.
Beautiful. Amazing. Thank you.
Sure.
So in your opinion, what are do you think the biggest gaps in our understanding of autism and what kind of research do you think is needed to fill those gaps?
Wow, that's a big question, right? First, I think we have to really define what autism is beyond behavior. We
Yes.
really have to understand the medical and physiological abnormalities that are underlying so we know how to treat them. Because one thing we know is that many of the things that we identify are treatable. And then we have to look at what are the most effective treatments. So we can have guidelines for docs to use because right now it's kind of like the Wild West. Everybody tries to do their best, but there's no major guidelines. There's just kind of, well, this is the idea, and I'm trying to do what's best for the child. And of course, one of the most, challenging things is that, you see one child with autism, you see one child with autism. So every is different. And that puts another level of challenges on the doctor and the family, of course, to find what the best treatment is. So we really have to understand what's going on and how we can treat it. And then, of course, we have to figure out the causes. How did we get here and how we can reverse that? And what we're finding is that many of these physiologic and metabolic disorders are not just in the child. So interestingly, we find them in the whole family. Um, it's interesting because Dr. Quatros, when he found this folate receptor autoantibody, he was working in maternal health because these same transporters are on the placenta. So he be working in subfertility and neurotube defects. And it wasn't until, he found that, well, applying it to autism really took off. And that's where, we found the application. But now we're coming full circle here. And I think we're now recognizing, well, these are also in mom too. And a recent paper we just published, we reanalyzed some of Dr. Quatros's family data, and we found that these not only run in families, but they run in what we call multiplex families. So there's two types of autism. There's simplex, where you only have one child with autism in the family. And then you have multiplex autism, where there's repeated children in the family. Of course, you would think like, oh, the ones that have repeated children must have some type of inherited genetic defect. Well, it's actually the opposite. It's the one kid in the one families that have one kid that tend to have the genetic defect more. And these multiplex families have gone unexplained. So what we found is that these antibodies seem to run in these multiplex families. So it might explain why these multiple kids. And what's really interesting is that they seem to increase across generations. So it seems to kind of get worse. It's something called anticipation, where the disease gets worse across generations. And you only think about this in genetic disorders, but we're finding this in this immunometabolic disorder that this antibody actually can increase, the titers increase across generations. So it can explain why we're starting to see more autism. This antibody is getting worse. And if you look back at the families, and this is something we're trying to do, you expect to see more infertility and other, issues, maybe cognitive issues, depression, and other things that may have gone unrecognized. So we were lucky we're funded by the Arizona State to now look at families in this way, not just look at the child, but look at their families so we can know more about this. And the exciting thing, of course, is not just the science of it, but that means that we may be able to identify these families before time,
Yes.
preconception, and actually make and treat them so that we prevent children from having autism and other neurodevelopmental disorders, and we can reverse the trends. But we see that some of the other metabolic disorders, we found that some of the abnormal mitochondrial function may be something that runs in families. There's studies that show that oxidative stress, abnormal methylation is found in the moms also of children with autism, some of them.
Yes.
Yeah, of course, inflammation, so immune system activation. So if we could try to start to map this back to the family, we can make the whole family healthier.
Yeah, definitely. And I think you're right that there's just so many layers and steps that we have to take even to just kind of be able to understand like what is autism? I come back to this question all the time. What is autism? I don't think that it's just one thing. I think that it's a combination of those like really complex underlying factors that kind of cause things to occur in the body and the mind and the nervous system.
One the cycles we have to really break is because science, we always look at things as, monolithic. But,
Yes.
we're learning that this isn't, and many diseases are like this, they're not monolithic. And until you look at them in this multifactorial, lens, it's going to be hard to understand them.
Yeah, absolutely. And I think another issue is that we already have it's 1 in 12 in California, I believe, and prevention would be great, but we already have like such a huge swath of the population who are already like affected with this disorder. Could you maybe tell us a little bit about some kind of the results that you have in your practice that kind of make you say like this is the way to go? As opposed to like a one size fits all approach. We're just kind of like ABA it to death now. And like that's all that there is. But what have
Right.
you seen that kind of says that there might be another way?
Well, I mean, I think it's all complementary, right? I don't want to put down ABA. ABA is great for some kids. Then there's other, I think in that sense too, even if we talk about behavioral treatments, we need personalized, treatments there because some kids do great in ABA and some kids don't, it's not for
Yes.
them. So it's not one
Mhm.
size fits all. So we also have to learn, the different behavioral treatments because they can be wonderful, but we have to find out what fits for the child. And then we have to also put on this other layer of making their bodies work, if a child, has pain, or hasn't slept well the night before, how do you expect them to, function? You know what it's like if you don't get a good night's sleep and you have to come into work? You can imagine if you're a child that can't communicate this, and this happens. So, we have to make sure one, they're healthy. You have to make sure that their body is working well, that of course, we see these GI abnormalities in kiddos, all kinds, and they do so many different things. Not only they cause discomfort, but then the nutrients aren't getting to the brain, can't work, and the body can't grow, right? And so when children come to our practice, we take a wide look at all of these things, and then try and figure out what things can we measure to tell us what direction to go in.
Yes.
And then we try and prioritize what's the most problematic that's causing other things downstream, and you can make so much of a difference. So, for example, sleep. We know there's lots of studies that a little melatonin can actually improve behavior, aggression more than probably a lot of risperidone, right? Just by getting them sleep. Aren't they not sleeping? Is it a GI issue? You have to, make sure that they're healthy, they're getting the right nutrition, they're on the right diet. Kids are very, very sensitive, and they need to be on the right diet. They react to many different things. And, for the most part, we should all have really good, healthy diets, right?
Yes.
But they especially need that healthy diet, that organic diet that's going to give them the nutrients that they need. And then we use, biomarkers, looking at mitochondrial function, B12 metabolism, you know, folate metabolism, see if there's any seizures at nighttime, to see is there something that we can do about those things and use, the first thing we use is the treatments that have the highest evidence. And, and that's what, Dr. Rosino and I have for many years written review papers about that, updating, okay, what is the evidence? And there's evidence, there is, surprisingly, on some things, there is evidence, good evidence of how to treat kiddos. And of course, it's important to guide families on what to do and what not to do, because you don't want them wasting their time and money and things that may not work.
Yes, absolutely. Let's dive into emerging medical treatments for autism, if we could. Leucovorin first, of course. Could you tell us what makes leucovorin different from a regular folate or a folic acid supplement?
Yeah, thank you so much for asking that question.
Mm.
So folic acid and I've tried to educate the media that, leucovorin is not a type of folic acid. So folic acid, everybody thinks folate is folic acid, but folic acid is the synthetic form of folate. It does not occur in nature. This is something that's man-made. And because of that, it has a lot of limitations. Our body has to activate it to use it. So, and that's a really important point because our body only has so much ability to activate it. So, after about 400 micrograms or so, which is about the amount you have in a high dose multivitamin, the body can't activate anymore. And so, what happens is you have unmetabolized folic acid, which again is not a natural substance. And we find that it can actually inhibit folate metabolism.
Whoa.
So, really important that people understand that you cannot treat a folate deficiency with folic acid. Folic acid is in our food. We have fortified foods, so we get folate. And there's, not that much. So it's probably enough for our body to activate, right? So that's fine. But it's then when we try and give higher doses and not realizing our bodies can only activate so much folic acid that things I think can go awry. And you have to use these reduced folates. So we call these reduced folates the more natural folates that can go
Mhm.
right to the folate cycle. And those are the things that we need when we need to treat folate deficiencies or folate pathway abnormalities. We need to use one of those reduced folates, like leucovorin, which is folinic acid, or formalin folate, methotetrahydrofolate. These are all different important folates that go right into the folate cycle, and they have slightly different purposes. I think it's this idea people think vitamins are simple, that you just take them and magically they make your body work, but there's very complex biochemistry behind them, that you really need to understand. And
Yeah.
so leucovorin we really like, and one of the reasons we like that, is because the gut turns about half of it into 5-methotetrahydrofolate. Everybody worries about, oh, there's this block there in the folate cycle, at the MTHFR. But essentially, leucovorin gives you two streams of folate that come in before and come in after. So it almost eliminates any worry about that enzyme. It's important to get folate in both areas. So everybody, knows about 5-methotetrahydrofolate. They think that's so important because that's the precursor for methylation, which is very, very important, right? We have methyl cycle produces our methyl donors, which turn our genes on and off, which are very important. But the other side of it, where formalin folate comes in, that comes into making something called purines. And purines are the precursor to DNA and RNA. So interestingly, if you don't have that, you will make mistakes in copying your DNA. And you think of what we're seeing, we are seeing all these new mutations. It also is important for making neurotransmitters and for something called nitric oxide metabolism, which is really important. So, you have really two really important arms of the folate cycle that you need to be concerned about.
Wow. Thank you. Awesome. This is kind of like the hot topic. Can leucovorin help a child who isn't showing folate deficiency in standard blood tests?
Almost definitely. So this is kind of the nuance. So some of the nuance of of treatment for cerebral folate deficiency is that you can't measure the level of folate in the brain just by a standard blood test, right? So the
Hmm.
problem is not folate in the blood, it's folate getting into the brain. And so that's
Okay.
why you need that lumbar puncture to test that fluid that surrounds the brain to see what the folate level is. And that's a lot to go through.
Yeah,
So
definitely.
so one of the contributions when this was originally described by Dr. Rainmakers and Quatros was they found that this special transport mechanism that transports folate into the brain, it was not working. And Dr. Rainmakers discovered this at about the turn of the century, and he didn't know why this was happening, and he thought it was a genetic problem. He thought that the
Mm.
folate transporter had some type of genetic problem, so he sequenced the genes, and he didn't find any problems. And that's when he teamed up with Dr. Quatros, and Dr. Quatros said, "Hey, I found this antibody that some people's body makes. Antibodies usually attack viruses and bacteria and protect your body, but some people have autoantibodies. They attack their own body. And he found that there's this antibody that binds to that special transporter called the folate receptor alpha. And it stops it from working and doesn't allow it to transport folate into the brain. So Dr. Rainmakers had figured out that maybe we could get around this block, and he used leucovorin, and that's one of the reasons we use it now. And the reason why he used it, besides it's the perfect folate, it's been around for 80 years. We use it to rescue the body from the ill effects of chemotherapy. So we got experience with it. We know how to dose it. We know that it's safe. So we know a lot about it. So he used leucovorin and essentially was able to go around that block and restore folate in the brain. And the way that that works is very interesting. The levels of folate in the brain are 2 to 3 times higher than they are in the blood. And that mechanism, that main mechanism that's blocked in this deficiency, actually pulls folate from the blood into the brain. It actively pulls folate from the blood into the brain. So when that isn't working, what happens? You don't have that pull into the brain. So to restore it, what we actually have to do is increase levels of this special type of folate, leucovorin, go through that carrier and be pushed into the brain. And so the other thing that we find is that because that process of pulling fully into the brain, that's an active process and takes energy. So we find that kiddos with metabolic disorders and mitochondrial disorders, where they can't make enough energy, also have that problem. So they have
Wow.
a different reason for that folate transporter not to work. And then we find that about 5% of kids also may have mutations that may not make it work. And these aren't mutually exclusive. So you can have one, two, or three of them in the increased severity. And so our goal is to really understand these, what we call biome, and figure out who is the best to treat.
Wow. Thank you so much. Could you
Right.
share with us, maybe just summarize for us some of the details and the results from that amazing clinical trial that you did recently on leucovorin?
Sure. Yeah. So we were kind of lucky to stumble upon this at first people, and that the first clinical trial, it was what we call an open label clinical trial. So we
Hmm.
gave kiddos, we treated them clinically with what we thought would be the best dose of leucovorin, and we measured what may change. And we looked at a wide variety of behaviors, and 2/3 of the individuals improved. And we found expressive language, receptive language, verbal communication, attention, and also stereotype behavior. But it was the language that was really, really, impressive, that change. I think that's the thing that impressed parents a lot. Their children started speaking. They started saying words, which is shocking to some of them.
Yeah.
So is the open label trial is open to biases, right? You're getting the drug. Maybe you want it to work, and you see these things. So you have to do what we call a double blind placebo control trial. And that's where you give out one of two things, either the active drug, or a placebo, a pill that's inactive. And nobody knows who is getting which. So the patients don't know, the doctors don't know, the evaluators don't know. There's only one person, the research pharmacist is the only one that knows who is getting what. And then, you keep yourself honest, right? Because you have to evaluate these kids and say which one is which. And I think one of the real advantages we had is that, most clinical trials in autism, they fail, they don't do well because the only measures we really have are these parent reported outcomes. And
Mm,
parents want their kids to get better. So we see this very large, what we call placebo effect. Even though the child may be on the placebo, the parents, see this change, then you make the trial fail. So what we did, we realized this was a real problem, and we keyed in. We're seeing this change in language, and language is something that you can measure. We can hire a speech pathologist that knows how to measure language quantitatively, and they're blind to if this kid's on the drug or not. And they can go in there and actually measure how impaired or how good the child's language is. So we were
mhm.
able to get a quantitative measure to measure actually the change in language in, exact measurement units. So, and with that, not only did we have an objective measure, we were able to compare it to other trials that have used language measurements or measurements of development to say, okay, this is approximately equal to this treatment or that treatment, behavioral treatment. And what we found is that, the leucovorin was equal to the best study on early behavioral intervention.
Whoa.
And then what we also found is we could compare it to how much change speech therapy was making, right? Because these kids were getting speech therapy also. And we found that 3 months of leucovorin was equal to 144 hours of speech therapy, which you couldn't even do in a year.
Wow. Wow. That's amazing.
Yeah, so we were able to really, put it, in dollars and cents, so to speak, to see what was actually happening there. Yeah, it was great. Some of the kids that, were pre-verbal were able to say words. Some kids that say words started putting words together. But even the higher functioning kids that were speaking in sentences had more sophisticated language measurements. We found that their ability to understand language, more complex language, actually improved. So it wasn't just language, wasn't just speech, but actually that processing in the brain that was improving.
Wow. Thank you. That is amazing. Quickly, I know that we're getting kind of short on time, but could you maybe tell us what are your thoughts on photobiomodulation?
Yeah, I mean, it is really a very interesting treatment. To tell you the truth, when I first saw it, I thought it was hokey, right into the brain like it's going to work. But we're doing a clinical trial on it right now, and we're looking at kids with epilepsy, if it can actually improve epilepsy, not only autism symptoms. And we have these kids, that have abnormal EEGs, or have epilepsy who aren't speaking, who within a couple weeks started speaking. I mean, it's absolutely amazing. The thing that is amazing about it also is that it's not that you have to give a lot of it. In fact, you can give too much and it's no good. So you have to be very careful with it. And not all the devices are the same. A lot of people say red light therapy. Well, there's a specific frequency of light that's able to cross into the brain. And supposedly the studies show activate the mitochondria in the brain and then help the brain work. It also supposedly decreases neuroinflammation too. And so I think we're still learning a lot about it. There's still a lot that we have to learn of how to apply it, where to apply it, and such. But the preliminary studies of its use is really, really promising, and it's very safe. Technology that's really easy to use. So, of course, we're stimulating the mitochondria, so we have to make sure that the mitochondria is ready for that, right?
Yeah.
So this is where the complexities come in. So it's important to talk to somebody that knows the nuances of it. But yeah, it's really impressive about how something that seems so simple and safe can really make such a difference.
Yes, absolutely. And Dr. Fry, what is the most important lesson that you have learned from your work in autism that you wish everybody knew?
Well, I think the most important thing is that a child, their ability to make progress is really related to their ability of their parents to advocate for them and not stop turning over rocks until they find, what's going to help their child. And it's hard for
Yeah.
parents. They get worn out, and discouraged, but their parents are really the heroes to find the treatments, to push the treatments. I've learned so much from parents. I'm just fascinated because I want to learn. I want to learn from them.
Thank you so much. And how can people find more information about the work that you're doing? Like, how can we support you?
Sure. So you can go to, we've started a foundation, myself and Dr. Rossignol, called the Autism Discovery and Treatment Foundation. And what we're doing is trying to develop, the most advanced treatments for autism and tests for autism so that we can find out, what's going wrong and what we can do to make it better.
Dr.
Thank
Fry, I
you.
really appreciate you taking time out of your busy schedule to chat with us.
Sure. No, that's my pleasure. Thank you.
Of course. And thank you to all of our listeners. We will catch you in the next one.